A screening test is a test that a patient gets when they're not having any symptoms. And the purpose of that test is to hopefully detect abnormalities at an early stage so that we can improve the patient's outcome with that specific disease process. Now in terms of colon cancer screening, that is a screening test in hopes of detecting colon polyps. Now a polyp is a small growth that grows from the lining of the colon, and over a period of years it can become a colon cancer. A patient doesn't go from having a normal colon to having colon cancer quickly. There is a process, and we found out that if we can find those polyps at an early stage, we can improve patient outcomes and patient survival. There are some guidelines, and almost all the major societies, the American Medical Society, the American Cancer Society, the American Society of Gastroenterology recommends that everyone who is at average risk should undergo a colon cancer screening at age 50. Now, average risk is just the normal person, just like most of us. There are people who are at increased risk, and those would be people who have had a first-degree relative, which would be a mother, father, brother, or sister who has a history of colon cancer, or if that patient themselves have had colon polyps or colon cancer. But routinely we recommend that at age 50, everyone undergo a screening colonoscopy. There are other tests that someone can undergo, but the gold standard test is colonoscopy. I would recommend that any patient who is 50 years or older and who has not undergone a screening colonoscopy obviously have one. And the best way to go about doing that is probably to talk with their primary care provider, who would then make a referral to a provider who performs colonoscopy. Here in Union County, it would be us general surgeons. I would like to say that most insurance companies currently cover screening colonoscopy at 100%.